during my lecture in San Diego the other day, I talk about this analogy with these American Girl baby dolls, and I'm just like secretly hoping these twins are little boys, so I don't have to buy them these injection molded $300 shakedown of baby dolls that we have to buy for our 2 other girls.
Oh, plus all the accessories, right?
Plus all the accessories, and every time you go to Chicago, you got to go to the store, and that ruins half your day.
Now, I just want to give a shout out to Sue Carr, kind of, because you see, Jan Gates came to 10X and she won an award at a different show, but she came to mine anyhow, and like you won like best innovation, and you were over there just getting your praise when you could have been hanging with us.
I know it was a hard decision, but I had to stick with my people. I'm humbly grateful.
Tell us everything.
And I promise I'll come next year.
Okay, promise accepted. But tell us about exactly where you were, what you won. Did you get money besides like
money?
what did you get?
It's funny because there's 2 awards on the same day. One is in Maryland and one is in Virginia. And the one in Maryland, I won Emerging Life Science Company of the Year last year. And the one in Virginia was Med Tech Company of the Year. So I had to go to the one I was nominated for, and I sent a representative to the other, but it was at Tyson's Corner in a movie theater. It was kind of interesting. They had popcorn and candy and appetizers. So it was kind of fun.
You're a pretty big deal winning all these awards.
I don't know. I'm just lucky, I guess. I don't know.
That's right. You're lucky with a medical device innovation. Just lucky innovation.
I'm getting there. Talk to me in December.
We met 2 folks at 10X. Anna, I don't know how to say her last name. There's like a Von in there or something. A gal who got her master's from Stanford, and she's bringing an innovation to market, and I think pretty much blew everyone away. And Alyssa's on the line too, and she did a fast round with us, and we were all like, oh wow. At the end I was like, this is recorded on May 12th, 2022, and I want that on the record that she was at my conference first before she got on magazine covers. Alyssa,
Nice
tell
to
them
meet
at home what up, Dave. That looks so much better than where I am right now.
It really is so much better, just to rub it in. Yes, that does not look like a fun experience. You've been there all night too, right?
Now I'm in Philly.
Oh, okay. Well, I mean, but you've been in a airport all night.
Yes, I slept under a child's slide in some kind of room for playing. I don't know, for 2 hours.
Pictures would be so valuable.
So this call is officially what you missed at 10X. So tell the folks at home what you talked about, because they missed it.
So we are bringing a spinal implant, a series of implants to market, and it's designed to stabilize the construct and prevent screw back out. Particularly with regards to the spine, it's the number one reason for spine failure is screw back out and rod breakage. And that means the screw is coming literally out the opposite direction that it came in. So the reason why we're having these problems is people are not recognizing the bone mineral density deficit and the different type of bone patterns within the vertebral body. It's significantly more porous from a macro and a micro structure. And the construct is designed for bone to grow through the screw to stabilize it. And we are hoping to have, for it to increase bone mineral density. Our team includes Coy Tan over at Duke University, Zach Ray, Chief of Neurosurgery at WashU, and Alekos Theologis over at UCSF. And that's it. That's our first product.
I need someone else to be kind of host while I walk to baggage claim and find an Uber. Michelle, you're nominated.
Got it. So that sounds fascinating. So how do you correlate the bone density to whatever needs to happen in the surgery?
So so there's no technique change whatsoever. It literally, the implant looks exactly like a standard pedicle screw, except for it has a 3D printed porous structure based off of the Gaussian curvature matrix and morphology. And so there's 41 parameters that grow bone, and you have to meet quite a few of them. The beauty of the implant is it provides options that were never before available for the patient to customize towards the patient's bone or the patient's, if they're immunocompromised. For example, a patient with diabetes, you can inject through the screw a resorbable calcium sulfate, mix it with a combination of antibiotics, and they can resorb within the bone for over the course of 2 to 4 weeks, which is nice because that's when you're going to start seeing the infection and the inflammation responses initiate. So if we can cool down that inflammation response and cool down that reaction, initially the patient's long-term survival is hopefully benefited with the implant. And then like if a cancer patient or a lesion is in there, but they still need to stabilize the spine, you can inject a cement in that one vertebral body, but leave the other vertebral bodies fine, uncompromised. So, and cement is calcium phosphate. It's used quite often in surgery. So for kyphoplasties, they use it all the time. So yeah.
Fascinating.
And the whole point of the company in the long run is to be the first company to combine regenerative therapies with hardware. So we will not be making those claims until obviously we have some studies to back it up, but it's just kind of common knowledge that if you utilize bone marrow aspirate concentrate or and now they're mixing with platelet-rich plasma and adipose fat, you're going to get the highest rates of bone growth and osteogenesis. So the goal is to increase bone mineral density.
Wow. Where are you in your studies and bringing that to market?
So we have passed simulation testing. That was the biggest issue, was the 543, 1770, and 1798 ASTM. We wanted to make sure that we met certain fatigue parameters prior to mechanical testing. So we are about to submit for mechanical testing within the next few weeks. And once we meet that, it'll be about a month, and then we will submit for breakthrough designation. And we're just going to utilize predicate device standards initially just to start commercializing it. And over time, as we collect data, we have a phase 1 and a phase 2 grant that we're submitting in September to collect data from a sheep study and a human study.
Okay. Wow. So that brings us back to the conference. Were you there? Is that where you're at right now? Okay. Yes. I didn't happen to run into you, but so the second guy, the guy who started on this second day, Mauricio.
Yes.
And what he talked about, I think if you're going to do that breakthrough designation, I got the pictures here, so we need to make sure you see those slides that he put up. It was fascinating. How to define impact with the DALY score.
Yeah. Yes, and the slide just prior to that one, if you go back to it, the spine is one of the largest. It was the third largest.
Just prior to that. I didn't compare that slide. But I got that one.
That's it. So right in the center at the very top is spine. And it's a darker blue, meaning that it's in a growth stage.
Yeah, the gray in here. So for those of you who weren't here, Maurizio is Terasaki Institute of Biomedical Innovation, and they're doing some pretty cool stuff. But Mauricio used to be on one of the panels, I believe, on the Gates Foundation, assessing like how they were going to invest. And he taught us that there was this score, how to define impact, with a DALY score, DALY. And I cannot read what all this means. Nick, do you know all about the DALY?
Disability adjusted life year.
Yeah. And so I think that it would be brilliant to use that score in your breakthrough designation to make it more quantifiable. and measure to the extent.
Actually, I'm gonna talk to him about, he offered to have a conversation about investing. And so at first I was like, I'm holding off for this neurosurgeon where he's very interested. And so, but then after I found out all of his background, I'm like, well, this might be even better. So yeah.
Okay. What was your favorite part of the conference?
Maurizio.
Okay.
That's because he's so specific to my field. So
Right. So I did a session with Larry Stevens and Rob where, hey, Karen Dave, where we talked about pre-subs and kind of did a little bit of role play and lessons learned. And I thought I got a kick out of Larry because he was just so, he was so the FDA. And everything he said, you're like, what? Like, no, it didn't really understand. And then B, it was so transparent at the same time about how the FDA really acts or works. And he was like, the pre-sub, like, they really don't want to meet with you in person. They really don't want a teleconference, that they don't see that as part of their role or their job. So I thought that was an interesting take to hear that directly. And so for me, I've always preferred written feedback only, but that really solidified it for me. Karen, what?
Michelle, why don't they like them? I mean, why don't they think that? Because I mean, I think a lot of my clients find it to be very valuable.
Mm-hmm. Well, personally for me, I find that written feedback only, they go into a lot more detail. And they will answer not only the questions you ask, but also go into detail about other things that you didn't ask. And sometimes indirectly tell you things that you wouldn't know about, like other things that they're under review. That's why I do it. That was also confirmed by Larry, but I think just personality wise and how the FDA acts, that they don't see those direct conversations with industry as a part of their role. It's more of like a necessary evil is the impression I got.
Okay.
From what he said. Did Alyssa or Karen Deep, did you get that same impression from Larry?
Yeah, basically I do feel like talking to the FDA, they're very vague. So
Yeah.
always a yes or no, it's always a maybe. And love what they're saying about data. That's just their excuse for everything. We need more data.
Yeah. Okay.
So everyone knows, in my opinion, Karen Deep won Best Dressed.
Oh, hands down.
You are sartorially splendid, my friend.
Are your suits bespoke?
They're tailored, but they're not bespoke.
Okay.
David Rutledge, this was your first 10X. What were your main takeaways?
Oh, you know, I enjoyed it all. I really enjoyed the pre-meeting workshops that were really valuable. And of course, the whole meeting was great. I really enjoyed the lightning round. I think that was the best for me because, you know, it was really fun listening to the presentations. And the films, your films were really cool, and how you use those to introduce the speakers. And I thought that was good. And I think the last thing would be all the F-bombs that were dropped during the meeting, all the F-bombs. So
I wish that the films were a little cheerier. There was only like 2.
Yeah, I didn't give you as many lines this year.
They were very dark.
They weren't all dark.
Yeah. And you played them at speed and I was like, what are they saying?
No, I didn't. Only one, the COVID one I sped up because it would have taken too long.
Okay.
The other ones were at regular speed.
I think one of my other favorites was Joseph Anderson.
He always is.
Yeah. I'm fascinated by just what he does in general. I think I'm going to invite him to do a podcast. But because
typically I get to see him only when I invite him to speak.
Mm-hmm.
And he's a friend. He's just so busy.
Yeah. Well, I'm super passionate about, you know, his cause that he's on, you know, especially given what his son went through as a baby. But because all of this is so avoidable. And you think about the large companies that are operating underneath warning letters and consent decrees, and they just keep thumbing their noses at the FDA instead of fixing the problem while patients continue to be injured or die. You know, you look at what Philips is going through right now. they're having to recall, replace, refurbish, refund every ventilator they've sold since 2015. And you tell me that they didn't have data to show that they were having problems. And then during COVID, so it's from 2015 to 2020, that whole period of time, they knew that they were having a problem. Then during COVID, it just really exploded because they sent all these even more faulty ventilators all over the country. So anyways, Joseph, I really liked as well. I thought it was very impactful. Let's see, who else was there? Ty, are you on now?
I'm on.
What was your favorite part?
I really liked Maurizio's presentation, especially when he put up that heat map of all the different indications and how they were growing and not growing. And he put it in his is all about venture capitalists and raising funds and having a good business plans. But from a regulatory perspective, it was really important because I could see how it could help our own regulatory strategy and how we present information. I thought he did a wonderful job of speaking of something that's really complex and nuanced, and making it digestible.
Mm-hmm.
I thought his presentation was good, and it was nice. It was I'm sure everyone's already said this. It was nice to meet a lot of people in person that I had talked to for 2 years.
Mm-hmm.
So that was a really good surprise presentation for me.
One thing I wish Basel had more time, because I feel like because the title of his talk was like a cheery update about MDR, and he ran out of time before he got to the cheery part. And I'm like, I don't know, all this still sounds pretty awful.
That did happen. I felt the same way. Michelle and I were both like, I wanted the cheer up.
Yeah. So I'm hoping to get his slide deck and see if the end of the deck, reveals what the cheery part is. Luke, how's that going for you guys? Have you seen anything cheery about MDR yet?
Nope, not at all. No, I still we are heading for a disaster next May.
Yeah.
Look, have you lost weight?
Who?
Have you lost weight?
No, a bit on my hands.
Maybe it's just you're not holding a beer. That must be what it's doing.
Oh, I have a beer.
Oh.
Rest assured, there is a beer.
Hey,
It's my weekend.
Joe, maybe his retouch my appearance button works, unlike yours.
I'm sorry?
I said maybe the retouch my appearance button works on his, unlike yours.
Where is that button?
Yeah.
Oh, it's just built into your camera for the most part.
Now, what I would have loved to be there, but what was the most what was something that was really new at the conference that you were surprised about?
Well, I think for I brought up Maurizio, Ty brought up Maurizio, and Alyssa brought up Maurizio.
Oh, you brought up Maurizio too? I missed
yeah. You came in just after that conversation. But yeah, I think everybody was Maurizio's presentation about innovations, insights from a seasoned venture capitalist was one of the most impactful presentations that I think we could all use.
Joe, what would be nice? Oh, sorry, Michelle. Joe, what will be nice is if next year you can have him go into more detail, even about his modeling, because he didn't really have a lot of time for questions. And he talked about how important it was to use, simulations, even as early as fundraising, which, simulations are extremely complex. And it would be nice to see how he balanced where he invested his resources in venture capital.
With the exception of the keynote, I gave him more time to speak than anyone, and we weren't able to make it done really. For those who don't know who Mauricio is, his last job was working directly for Bill Gates on I forget what they called it, but it was basically make world better, and people would come to him with projects, and he would help the foundation decide how to deploy the resources with the most impact. He kept talking about impact, what projects to work on, the ones that can help the most people, type of thing. And he showed a modeling of how the presence or absence of mosquito nets impacted. I forget what country did he choose.
So he showed simulations of Madagascar and how different treatments, like the treatments that he had developed, would potentially impact in a very sophisticated simulation. You know, that clearly cost millions of dollars to get. But he just put a lot of emphasis on it, and I was curious to see where in the process that he put that for someone who was fundraising. Obviously, those kinds of simulations aren't really feasible because they're so
maybe
expensive.
I can get him to do a Friday with us, so we don't have to wait a whole year. But
So Joe, he
one
was
thing I
at
did say,
Mauricio was at Intellectual Ventures.
yes, that's right.
Was
Thank you.
the company in Seattle here. Yep.
Yes, that's right. Thank you. And it continues. I asked him kind of what led to that transition, and I think it was more geography than anything, because he lives in LA, and I didn't know that. I knew him only in Seattle, in Redmond. So I guess just to spend more time with family and less commuting, he is now with the Terasaki. Had you heard of the Terasaki Institute? I hadn't.
No.
Yeah, there were a couple. I was so impressed with Vivek.
That was who I was going to bring up next, is Vivek, and that was such a great story.
He in 2015, my first year bringing the event to San Diego, he was less than a startup. I mean, it was like parents' basement, and he and his friends got in a car and they stayed at a Motel 6. And I had given him my recollection was reduced price. He corrected me and said that I let them come for free, and how much of a difference that made. And I personally was very touched by that. And his father-in-law was in the audience. He came in special to get the presentation. He was there for an hour and left. He flew in from Utah and is flying home. He lives near you.
He lives in Phoenix.
I basically lost track. I mean, I tried to keep in touch with him, but he wouldn't basically answer, my notes from time to time. And I finally got a hold of him, and I didn't know that he became, one of the 30 under 30, and I didn't know that his company was now doing 10 million a year, and I didn't, and just to see, he's now got a 4-year-old, and all these things that had happened since, and it was just really lovely. It just felt like love and karma, and just kind of reuniting us. And just for me personally, that was a real highlight.
What I liked about his presentation is when somebody asked about how did he pick his first leadership team and his first employees, and he had a real honest answer. And he said, your first set of employees are not going to be your next set of employees. Like the skill sets that you need to get from startup through early stage and regulatory clearance is a different set of people than you're going to need when you go to commercialization, is a different set of people than you're going to need when you move into rapid scaling and multiple revenue, growing your revenue. I thought that was a super honest answer. He also said that he originally had 4 co-founders, and then he's bought out all but one because they weren't the people to grow the company.
Yeah, his answers to that was great. It was really honest and not in a fantasy land. I really respected how candid he was, because I started at a startup, and I started as an engineer, and I adjusted my role for what they needed. But by the time I was ready to go, I was ready to go. There was no work for me to do. The job was quiet. We were in clinical trials, and I didn't want to do clinical trial monitoring for the next 3 years. And so I left. And that's a real thing that happens in startups. And I think that people don't talk about it, or they talk about it like it's a bad thing, that you're like letting employees go because they're not the right fit, or you're leaving that job yourself because it doesn't meet the needs that you have. He had a great answer for it.
It's kind of interesting because I actually don't like big company at all. because of the amount of hurdles and personalities you have to go through that are not open to out of the box thinking. You know, it's like one way, I'm struggling with that with another client right now, but I absolutely love consulting because if I don't fit, I just introduce them to somebody else they might fit better with and move on. And there's no hurt feelings.
How do you have that conversation about like, this isn't a good fit for me because you're an asshole?
Oh, it's very, I have so many examples. Unfortunately, the first one was, I can't say the company, would be fair, but they're out of Santa Cruz and they were compromising quality. I wasn't moving anywhere. And I got on the phone with the CEO and the CFO. And I said, I'm a doer and you guys are struggling to do the things that need to be accomplished. You're in this transition phase. I don't think it's working out. I'm not the best fit for you. I think I'm going to give you, and I usually give them 30 to 60 days. I don't terminate right away. And I think that's the positivity of my transitioning. And then when I leave, I call it the Nelly memo. I don't even know what else to call it. They'll get a dissertation of everything I did for them. And it's usually anywhere from 20 to 60 pages. And then if there were hurt feelings, by the time they get that and they've read it, every single time they've emailed me back and like, wow, you did a lot for us. Let me know if I can be a referrer for you. I mean, it's turned that way, except for the last termination. I don't think I'm going to get that experience, but that's because they didn't want to pay me.
Mm-hmm.
They were a company that didn't pay their employees or their consultants or their suppliers. And so I terminated for lack of payment.
They won't be a company for long with that process.
Well, but I still upheld my integrity. I still did the Nelly memo or the transition document and sent it off. And my girlfriend who I work with, she goes, I can't believe you still did it. And I go, I will always leave a company with integrity, even if I don't like the people there.
Robert Central Pediatric Research, right Center City building. It wasn't there when I was.
No, Joe, you're there's too much
There it
background.
goes. Yeah. I find that it's usually helpful to approach them and say, I don't feel like I'm being very effective, or I don't feel like I'm accomplishing what you want me to accomplish here. And it's kind of the same thing as Nelly. I want to do. I want to be helpful. I want to be adding value to the company. Sometimes that is yeah, we weren't ready for you, or, we're going to go a different direction. Sometimes it's oh, we didn't realize that. And we have a really good discussion and we reset what I'm doing and what my responsibilities are. And then I continue on. So, sometimes companies, particularly if they're startups, just don't understand how to use the consultants they've got. So you got to train them to figure out and say, this is what I will do for you. This is what you need to do on the other side. But I've left company because they've said, will you come into a quality management system? I said, sure. I will set it up for you. You need someone to run it. And after a year, there's nobody else there to run it. And I'm fortunate enough up here that I know a lot of other consultants. So in many cases, I'm able to say, I don't think I'm being effective, or I don't think I'm the right resource for you. Let me suggest somebody else who would be. And those transitions have always gone very smoothly. And it works for me because if I'm not doing the work I want to do, it gets me out of there and it gets somebody else a job.
Well, what's also interesting, that's an excellent point, is sometimes when I have somebody who's, the one person I left the first client, they kept trying to keep me, and they kept extending it and extending it. And I finally said, I don't think you're spending your dollars wisely because I'm not the resource that's going to get you where you need to go. I had to finally be that blunt, right? And as soon as I said the dollars you're spending, they're like, oh, wait a minute. We are spending a lot of money on you. And to your point, introducing him to somebody else, because I never leave them hanging unless I wouldn't refer my mother. If I would not refer my mother there, then I would just say, you need to find your own resource, politely.
Interesting.
It's not fun, but I
don't want to put somebody into a position or to work at a company that I just don't want to work at. So yeah, if there is a situation like that, sometimes people want work, and I try to be really transparent with the person I'm talking to about as a replacement, so that they can say no, or I'm too busy, and gracefully back out.
I know that I do a lot of role playing with it. So I'll role play with Hage, I'll role play with a couple of my other associates before I have the conversation with them.
We had to leave at 12, so I didn't get to see the afternoon things. what about when medical device innovations break down, and how to fix it? What was the takeaway there?
I thought Ty did a great job. Does everyone agree who was in the room? He had basically 4 pillars of what's required to do innovation, pardon me, effectively. And he had some examples of folks who had, 2 of them or 4 of them or 3 of them, and what the impact was. And then immediately after him was Shrika from UserWise. Shannon got COVID, which is an odd choice versus going to a conference. I personally would have gone to the conference. And they compared and contrasted the differences in the way that they approached user design. And I thought it was a nice contrast. And then the last speaker, Greg Grissett, also chose COVID over 10X. And I was able to get a cybersecurity person who's actually a fellow alum. I just get such a rush being on campus. I just loved going here. And she talked about cybersecurity in an expectedly frightening way that makes us all wonder about the state of our civilization.
That sounds sobering.
Yeah. I actually played a funny video before she went. So.
Too bad I missed that.
Who else is on the call that was present, and what stood out for you?
Feel free to say that my workshop with Rob or the pre-sub thing was your favorite part too.
Larry did a perfect job being the FDA. I felt like I was I mean, he's had all that years of experience, but just even when you guys were acting it out, I was like, oh, this is the FDA. I can see it. I can hear it.
Was I the only fanboy in the room for Dave Albert? I was just in awe of what he's accomplished in his stories. Were you guys?
You know what I'm in awe of, Joe? The people you know. How do you know all these people? It's crazy.
I've been doing that instead of doing my job.
Yeah. One thing I'm always impressed with is Daniel Shepard's hair. It's the most amazing waff.
Did you meet his son, Mason? Mason and his wife were there. Yep, he had the baby carriage there at lunch.
Okay.
I wanted Mason to co-present, but he said his wife was not cool with that. Karen Deep, what stood out for you, if anything?
Just to get perspective on different things. Obviously, I work within quality and reg, and we see it from one side of the fence, but get to see investors, people who work in sales, strategy. That's something I've never really thought of in the past, but now I can see the importance of strategy. So I got to see it from different perspectives, and I can carry that back to my work effectively. And I now know where those resources are. So if any of my clients say, I need a strategist, or I need a funder, and things like that, I know where to point effectively now.
It's my favorite thing. That's why this exists. And in fact, I'll tell you that I'm especially more grateful for you guys today, because, as soon as 10X is over, it's like, okay, I got to pick a date for next year, and I got a clean slate. I better find 17 speakers and, 12 to 20 fast round people, and it's, starting over. That part's not as fun. But now I feel like there's a team who, it's our event. So yeah, I know some cool people, but you also know some cool people. And so Dwayne had said, I'd really love to see a panel. And I said, I kind of hate panels because usually 3/4 of the people at any given time are just sitting up there and they don't know what to do or say. And it's just awkward. But some people were like, no, I think if you did a panel on cybersecurity, for example, and we all tried to hack something or to do this or that, which are things I wouldn't have come up with on my own. So, my most hearty encouragement for you, if you know someone or a topic or you've seen somewhere and you'd like to have that be part of our experience next year, then let's make it happen. I mean, I have infinite flexibility on that. Joe finished his point. Someone say something. How was your anniversary?
was very nice. Thank you, Joe.
Where'd you guys go? You went on a cruise?
No. It just went down the shore.
You went down the shore instead of coming. All right, whatever. I don't know. I don't know what to say about that. Just
So,
relaxing,
Joe-
the two of you.
That's it. Just doing nothing, which is the best.
And Bushman, what was so important that you had to miss?
Well, so May is a very busy month for me. And so I've already taken a ton of time off and I had to do work for clients. I was behind. So really it's like, so let's see, it's Bonnie's birthday, my son's girlfriend, my birthday, Brandon's birthday, Mother's Day. So it's like May is like the worst month for me to travel anywhere. That's why.
All right, well, I'm giving you 52 weeks notice for next May.
Now, do you have it in May every year? Oh, darn.
Well, I typically do, or the last week of April. I try to do it when the weather is clement enough and it's not summer. And if I do a fall one, you know, I'm not prepared this year to do it, but maybe 2023 I can do 2 cities. And I really enjoy doing London. I'd like to bring it back there.
Oh no, Paige and I are going next year. We just couldn't get it in the budget with the amount of money I'm spending so far. So
Joe, is it possible to do it in September? Because May is really tough for anybody with kids, a mom, spring break, you just get over spring break. And
Well, I mean,
it's
couldn't you
cheaper
say the
rate.
same that September is when everyone's going back to school? I mean, is there really a winning time for everybody?
I think trying to shove it into May with Mother's Day is a problem for a lot of people.
Well, that's why I
And
make the
Memorial
point of having it be, that's why it's never a month. The first 2 years, maybe 3 years, I had it the day after Mother's Day, which meant mothers had to fly on Mother's Day. And I learned the hard way, that's not a good idea. So
Well,
there's
most people go out of town for Memorial Weekend, so that's off the books. And then if you have 2 weekends completely off the books or weeks off the books, I mean, September is a good month and October is usually a good month. What do you guys think?
The problem in the fall for anybody on the commercial side is if trade shows ever get going again, it's basically September, October, November.
Yeah,
That's a good point.
September,
Yeah.
October, November is submission season for us.
okay.
Everyone's
Well,
got
everyone
their
can
spring.
send me a text of their preferred timing, and somebody
What
knows
about
how to do
mid-June?
like, huh?
what about mid-June? Is that, I mean, I'm just throwing it out there.
June becomes Father's Day and graduation. That's even worse.
Oh,
And it's expensive for the hotels because people are traveling.
I don't know. The last week in April sounds pretty good because it's right before everything starts.
You guys want to move it back 2 weeks to the last week of April if I can get the hotel that week?
Sounds cold.
Oh,
Well, it is San
Not
Diego.
in San
so it might
Diego.
be-
I thought it was freezing. I
Okay,
live
we
in
had a winter
Tucson.
now. We had
I
a
live in Tucson. It is always cold in San Diego to me.
Joe's gonna have
You
to
want
move to
it
Honolulu then.
Tucson? You have a big house now, Michelle. Should we just hold it at your place?
I did. I live across from the El Conquistador, the Hilton, so that'd be a great place to have it too.
I'd love to go to Tucson.
I'm afraid of where this vote is going, but how does everyone else
You
feel
wouldn't
about
love to
going?
come to Tucson in May, though. You
Well,
would
we
melt.
went in April though, so I like hot weather. So I have fibromyalgia and arthritis. The hotter it is, the happier I am. My husband, on the other hand, has to have it freezing cold. So we're never really in the right location.
Well, your husband's
Yeah.
on it.
We can get to vote.
Yeah, I was bummed I didn't get to go. I really wanted to, but I just couldn't make it work.
So, back to the
How
conference.
about you, Kevin? This was your first. What were your takeaways?
It's honestly, it's one of the best things that I've been to. The quality of the people and also what's that?
Because of the people, yes.
Yeah, and the size. I mean, you have a chance to talk to, almost everybody one-to-one. Sorry, I had to run out on you yesterday. I had to, I had an interview put on my calendar for this afternoon, and I didn't want to have to take a red eye and then head into that.
How did it go?
It's actually after this.
Oh, okay. Good luck.
I should have grabbed Michelle or Rob actually for some conversations yesterday afternoon if I didn't run out, because this is kind of going in a slightly different direction on manufacturing, where I come out of pharma, where nobody wants to change anything, and this is a personal care manufacturer that's into Lean Six Sigma and wants to always change everything.
That sounds fun.
Yep. Again, I come out of pharma where you build the factory, you file your NDA, and nobody changes a damn thing for 30 years.
So personally, this is an interesting question. The reason it's the size that it is simply because that's how many people wanted to come. I've not restricted size. In 2017, we had 200 people come, twice what this was. And for those, I don't know if anyone's on the call who was, well, Marin, you were, did it feel too big? Did it ever feel too big? I didn't think so. I'm under the impression that the more people, the more possible connections. So, I mean, I really feel as though I'm in the connection business more than what interesting speakers we have. I think everyone to a person will agree that lunch, breakfast, ice cream, reception, and drinking afterward were the highlights. As great as Mauricio was, as meaningful as Vivek was, it's the conversations, getting to know people and relating. And the more people you have, the more people you can do that with. So I'm always trying to get more people, and frankly, oversharing. I'm usually depressed in April because I'm not happy with the numbers. Oh, I wanted it to be 150. Oh, I wanted it to be 120.
Well, it depends what it is. So to put it into context of my comment, I mean, in my experience in the flavor and fragrance business, we had an event like this that when it started, 25, 30 years ago, it was always maybe about 200, 250 people. And now it's grown to about 1,500, and that's completely unmanageable.
That's not what I'm planning.
Yeah.
I see no reason, no catalyst that would make it grow 15 times or 10 times.
Because that used to be something similar to the 10X, where it was very much more social, and it's turned into nothing but a commercial endeavor with basically speed date type meetings all day for 4 days in a row, half an hour back to back to back to back, and everybody skips the seminars.
I can assure you that is not an event I would be hurting.
Yep. And my personal favorite, Joe, is always Nick. His take is very interesting and somewhat depressing a lot of the time.
Nick, would you like to reply to your overall depressing nature?
Yeah, you wouldn't be a good economist if you were on the bright side. That's for the financiers. I watch enough CNBC to know the difference between happy finance guys and depressing economists, and I fit into that latter category.
Yeah, I wanted to catch you actually afterwards, and I missed you before you left, only because I kind of want to make a comment to you. A lot of what I've done in the last 15 years is actually on the infection prevention side, and there the commercial opportunities boomed because of the fact that HAIs are no longer reimbursed by CMS.
Yeah, the pressure's been put back on the hospitals, and it's like, you guys clean up your thing. I mentioned, I think the other day, every 5 days you're in the hospital, your chance of getting C. diff go up 500%. That it's like the CMS is saying, you guys clean up your hospitals. Don't bill us for your lack of disinfection. And I think it's a good move.
Yep.
Yeah, I mean, everybody's heard me on this thing. No, I'm not optimistic about the future of healthcare. I have hours upon hours of evidence and information, and I mentioned to a group yesterday at Boston Scientific, the 10-year treasury was 1.7% in January. It's 3% today. As things get more and more expensive for the government to borrow money, they're going to cut reimbursements. I give it 1 to 2 years before CMS gets a phone call from Congress and says, the $4 trillion we've been handing you every year is now getting cut to $3 trillion. Well, all of our new fancy medical technologies that we're coming out with that are going to solve every problem are going to get axed. It's very difficult for me, Kevin. I don't take offense to your comment at all.
My background is economics too, so that's
okay. We can commiserate.
Yeah, exactly.
No, I don't take offense to it. I have a hard time. I went to a meeting in Orlando a few weeks ago, and it was just sunshine and sunshine and sunshine. And I'm like, does anybody see any headwinds? Like, are you not allowed to present even a modicum of headwind discussion, or do you have to bury that and we just talk about how wonderful the future is going to be in perpetuity, ad infinitum? Or can we, for a minute, look at economics and say, I see some real headwinds. I see 10-year treasuries going to the moon. I see our United States debt going to the moon. This is going to be very difficult for us medical device people to go, I do have a cool technology and it will alleviate morbidity and mortality, but Medicare has to pay for this. And if Medicare goes, we would love to pay for it, but we just got a phone call from the United States Congress cutting our budget next year from 4 trillion to 3.3 trillion. We're going back to the basics in healthcare in the future. I think a lot of these new high flying, cool, innovative, amazing things are going to get squelched, not for any scientific reason, but for economic reasons. Well, it's difficult for me to go stand in front of 30 people and give a 3-hour lecture and be like, ignore all that. The future's great. Everything's going to be just fine, you know, despite all these things that I stare at all day long on these 3 computer monitors and on these 2 computer monitors. It's very difficult for me to be the eternal optimist. I'll leave that to Joe.
No, but it's an important take from the business side. Obviously, I mean, you don't want to invest money in a product that can't get paid for.
Yeah.
And then the flip side to that is if you're trying to build a company, it also affects how you make your pitch to investors. Yeah. And by the way, I'm going to make a referral to you of a friend of mine who's an angel investor in an orthopedic thing, and I don't think their doctors that they're backing have really done this reimbursement analysis.
Okay, thank you, Kevin. That'd be great.
So I'm on a screening committee for an angel investing group in Seattle. I'm on their life sciences screening committee. One of the things we always look for is what's the reimbursement path. So if you have questions on that, feel free to reach out to me too. But I've been doing angel medical device screening for 8 years now for investors.
I think Nick has a point. However, I think there's a happy medium with this, particularly for companies that don't have the overheads those are the ones that are at risk more than anything, because for example, a pedicle screw costs them $56 on average to manufacture, and they're charging $1,400 per pedicle screw. Now, and that range goes between 700 and 1,400. The government's getting a lot of pressure to have some form of insurance that's much better for universal healthcare. So they're going to still invest because that's what the people want in healthcare, but the reimbursement is going to go down. So therefore, the Medtronics and so on and so forth are going to have to pull down their pricing. However, that leaves room for opportunity for startups that don't have those massive overheads to really take advantage of the market, in my opinion, as long as they keep the cost low. The businesses that are strategic enough to keep the cost low are going to be, and they're going to innovate, are always going to be the ones to succeed, particularly in an economy like it was in the 80s.
Hey guys, I have a lot of people to go downstairs and love, so talk as long as you like. Michelle is your host. I don't believe I have a speaker set for next week, so any volunteers will be welcome. And I really enjoyed seeing you guys this week, so see you next week.
Bye, Joe.
Bye, Joe.
Bye.
Bye, everybody.
So I just have one last comment. Nick, you have been called depressing, and I have been called sobering on at least 5 different occasions. So I think that me and Nick should do a webinar together or a workshop with the next one.
Yeah.
I agree.
Put it at the end of the day when we can drink while you're doing
it. Yeah.
I think it needs to be while we're drinking. Yeah. And I'm not, I wouldn't judge about it being first thing in the morning and we do it with Bloody Marys and mimosas either.
Yeah, it's funny. I mean, when I speak, I've looked at my resume. I keep track of all of these. I like keeping track of them. Over 80 times have I lectured. I've been on national, at one time I spoke to 10 million people at once, on this big national TV show that I was on. And I've done some big things like this, but I genuinely feel sometimes like there is a tendency or something to ignore, because it's not pleasant. It's not pleasant to stand in front of 30 people, 300 people. I spoke to 150 people in February in San Diego. And to stand up after everyone is saying, hey, we're the new 3PL logistics for first mile, we're the new 3PL logistics for last mile. And, we have this new program that's going to do this, and it's always sunshine. And then you stand up and you're like, guys, I don't know. Am I the only one that's about to say something over here? like left of sunshine, you know, that I don't do it to be provocative. I sometimes I am provocative for the fun of it. There's a little Bill Burr comedian, you know, inside my soul. But I do it because I think it's like, man, maybe I'm going to be the only one that stands up and goes, I don't know, the fact that it's twice as expensive for the United States government to borrow $1 in May than it was in January. Our debt is 30 trillion. When Barack Obama took office, it was 7 trillion.
But
That
are
was
you
just a few
factoring
years
it?
ago.
I mean, we're talking about a pandemic here. So if history repeats itself, in the 20s when this happened, or in the Great Depression when this happened, yes, it's going to happen, but there will be a rebound, just like there always is in history. And if we learn from history, we understand that the Industrial Revolution happened and the K-curve happened with the economy. That's where the rich get rich and the poor stay the same or get poorer. So which trend do you want to be on? Because right now it's trending to be a healthcare and technology trend for innovation, as long as you keep your costs down.
Sure, Alyssa, we could go on all day. And I this is something I eat, sleep, and drink. I write about, I publish about, I speak about, that I'm not ignorant to the fact that yes, we'll have some downs and we'll have some ups and we'll have some downs. But no, there's a big part of me that is not optimistic about the future of healthcare in the United States and about medical technology innovation. And I've innovated technologies. I took a company public on NASDAQ. I've been the guy standing there clapping when we push the button and CNBC films us. So, I mean, I've been in all aspects of this. I've been a payer. I've been in the hospital value analysis. I've been on all aspects of this. And no, I do not think we can take necessarily, this is where I would disagree with you. I do not think we can look back at the 20s and apply that to today. We are in such a dramatically different world than we were in the 20s. I mean, this debate could go on all day long, but when Joe asks me to speak, or I do speak at these other conferences all year long, that I will stand up and say, maybe I'm right, maybe I'm wrong. I don't know, time will tell. But man, I've just heard 16 wonderful tales about how the future is going to be phenomenal. And I look at other economic aspects that I don't hear anyone at conferences talking about. I don't hear anyone talking about national debts, $90 trillion of United States debt, 30 trillion of it's federal. That no one sees that as a headwind. Like no one sees the overnight Fed funds rate going up this much to combat inflation at this rate as perhaps being a headwind that we're not ready to address. That I go to conferences and I'll hear 30 or 40 people. I'm in Washington, D.C. at a meeting Sunday through Wednesday next week, and I guarantee you it's an economics conference. I won't hear one person talk about big type macro things, but I'll hear about this new way of defining how much physicians should get reimbursed, or this new way of paying hospitals, or this new model, or this new model. And it's like, we're rearranging in many regards deck chairs on the Titanic. That is anybody willing to talk about the ship or the iceberg? And I have to be the a-hole that stands up and goes, can we just talk about this for 1 minute? Like, I understand there's some cool deck chairs and they need to be rearranged. I understand that, but can somebody please just for 2 minutes, some Austrian economic theory leaning individual stand up and say, when you shove interest rates down for a decade and you print trillions of dollars, look at the Federal Reserve's balance sheet, that creates a bubble. And when that bubble bursts with the debt that we have, we meaning not just the United States, worldwide, 70 trillion government debt around the world, I don't know that we're prepared for that type of a thing. That's nothing we've ever lived through in the 50s, 20s, 1870, 1603. So when I am a wet blanket on this, it's like, man, I don't like being that guy. And personally, I'm not. Like at home, I'm not. We have a lot of fun. But when I get on stage and I'm asked to talk about economics, I talk about economics. And I'm sorry, I don't see sunshine. I see a lot of major headwinds. So
I think you can even put aside, though, kind of the long-term prognosis. It seems to me, listening to some people, that they're ignoring some of the economic realities, even in the current system as it's structured, as they're looking at product and how they define addressable market and that, it's a better solution. So therefore, somebody's going to buy it automatically just on the scientific merits.
Yeah.
Hey, Nick, where are you speaking in DC next week?
I won't be speaking. I'm just attending ISPOR, the Society of Pharmacoeconomics and Outcomes Research. So I'm not speaking at this one. I'm just an attendee.
Because I'll be in DC a couple of days next week. Maybe we could pick up. I don't know.
Let's do it. Let's do it. We could, I
think every single company should have you on their team, because if you expect the worst and prepare for the worst, you can hope for the best. And I think you raise a really, really poignant point that you have to anticipate the worst, because it's usually going to be 30% worse than what you anticipated.
Yeah.
So, I think that you need to be speaking at every single conference, but I do think it for every problem, there's an opportunity.
Yeah.
And if you are prepared for it and you anticipate it, you can be on the forefront and turn into eventually the Medtronics and Strykers when the economy stabilizes.
Yeah, I'm with you. I'm going to jump, everybody.
Okay.
Happy weekend.
On that note, I think it's time to close the call.
Yeah.
Have a good weekend, everybody.
Thank you,
Thanks, Michelle.
everybody.
Bye.
Bye.
Bye.